Welcome to The Explainer. We're jumping right into a really fascinating and literally life-saving intersection of modern medicine today. Imagine a spider web for a second. Looks fragile, right? Like a breeze could just tear it apart. But structurally, spider silk is actually stronger than steel. And when the web takes a hit, it can be rebuilt incredibly fast. We're going to use that spider web metaphor today to untangle a super complex reality. What actually happens when someone is diagnosed with both cancer and heart failure at the exact same time?
To really ground the science, I want you to meet Samantha Edel. She says, every sunset, every sunrise, everything is like the best that it's ever been in my mind. You hear that and you might just think, wow, Sam is a naturally cheerful person. But that fierce optimism, it was forged from surviving a sequence of events that is almost unimaginable. Her personal web was hit by a storm that most of us could barely even comprehend.
Here is the harsh reality she faced. Postpartum heart failure followed almost immediately by a double breast cancer diagnosis. Talk about being pushed to the absolute breaking point, right? Her body, her mind, and her whole support system were tested to the absolute limit. So let's get into section 1, the ultimate double diagnosis.
Let's actually walk through Sam's timeline, because it's a nightmare. First, she and her husband spent years going through the grueling IVF process just to conceive their daughter. Okay, then an emergency C-section leads to sepsis. And then just 5 weeks post-birth, she gets diagnosed with postpartum heart failure, also known as cardiomyopathy. Finally, just months after bringing her baby girl home, right when they think the worst is over, she finds a lump. Double breast cancer. The sheer physical and emotional toll of fighting so hard for a child, only to be struck by two life-threatening conditions back-to-back, it's just staggering.
Now, the medical term for this specific danger Sam was facing moving forward is CTRCD. That stands for cancer therapy-related cardiac dysfunction. In clinical terms, this is when the heart's pumping ability, specifically the left ventricular ejection fraction, drops by at least 10%, falling below a 50% baseline. It's not just a vague risk, it's a quantifiable, incredibly dangerous clinical condition, and it meant Sam's already weakened heart was in grave, grave danger.
Which brings us to section 2, how cancer treatments harm hearts.
And here is the incredibly cruel medical irony of the whole situation. The exact medications required to cure Sam's breast cancer are known to be deeply cardiotoxic. They can permanently destroy the heart. So think about it. If your heart is already failing, how on earth can you survive the very chemotherapy that's meant to save your life? This intense medical dilemma is exactly why the emerging field of cardio-oncology is an absolute game-changer today. Let's break down the biology a bit. Foundational chemotherapy drugs used for breast cancer, called anthracyclines, basically directly attack the heart muscle. They do this by jacking up reactive oxygen species, which causes massive oxidative stress, and by binding to an enzyme called topoisomerase II. The end result? It disrupts mitochondrial function and triggers apoptosis. And apoptosis is just a fancy word for programmed cell death. So yeah, it literally kills off cardiac cells. But wait, it gets worse. This biological assault compounds with targeted therapies like trastuzumab, which are HER2 inhibitors. Instead of direct cell death, these drugs create a totally different but equally dangerous pathway to heart failure. They inhibit cell survival pathways, leading to endothelial dysfunction. Basically, the blood vessels don't dilate the way they should. This impairs blood flow to the heart muscle, starving it of the oxygen and nutrients it desperately needs to effectively pump. So, facing down these twin biological assaults, we really have to ask the million-dollar question. Can we protect the heart without stopping the cancer treatment? Because look, if a patient's heart starts failing, you have to stop the chemo. But if you stop the chemo, the cancer spreads. It's a terrifying catch-22. Let's look at the solution in section 3, the cardio-oncology safety net. Dr. Candice McGuire from VCU Health sums up the stakes perfectly. She says, if we had not had cardiology input, we probably would have pulled our punches and used less chemo, which could have affected her cancer outcome. That quote right there highlights exactly why working in medical silos is so dangerous. Without specialists collaborating, doctors are essentially forced to compromise on life-saving cancer therapies just to avoid wrecking the patient's heart. But when they weave together a multidisciplinary web of safety, the whole picture changes. You've got cardio-oncologists actively protecting the heart, surgical oncologists physically taking out the tumors, and radiation oncologists hunting down those rogue cells. The secret sauce, though? Seamless, continuous communication within a single medical system. It's a team approach that shields the patient from every possible angle. It reinforces their web so it absolutely does not break. Moving on to Section 4, Cardioprotective Meds. To the rescue. Now, what's super fascinating about this protective arsenal is that, aside from the first drug on the list, these are actually conventional heart failure medications that have been brilliantly repurposed for cancer patients. We're talking about standard ACE inhibitors like enalapril, angiotensin receptor blockers, or ARBs, like candesartan, and beta blockers, like carvedilol. By using these proactively, doctors can literally build a suit of armor around the heart before the chemotherapy even hits. I do want to single out dexraxazone, though, because it is a total star player here. It's an iron chelator. That means it binds to iron to stop those damaging superoxide radicals from ever forming. And what makes dexraxazone so incredibly special is that it's the only FDA and EMA-approved treatment specifically targeting anthracycline cardioprotection. Best of all, it does this without reducing the cancer-killing power of the chemo. It's kind of a medical marvel. Now, let's be totally transparent about the clinical trial data, because results in large-scale studies are honestly a bit mixed. Beta blockers are the most extensively studied, and they definitely show strong promise for preserving heart function. ARBs and ACE inhibitors, well, they've shown protective effects in some trials, but not all of them. But here is the overarching clinical consensus. For high-risk patients, giving proactive pharmacological protection is absolutely vital. You can't just wait and see. And if you need proof of why managing cardiovascular health during cancer treatment is so critical, check out this number: 58%. According to a recent study in eCancer, that is the massive drop in mortality risk for metastatic breast cancer patients who just consistently take their blood pressure medications. 58%, that's huge. The takeaway here is that managing comorbidities, like high blood pressure, is just as critical as attacking the tumor itself. Researchers found that polytherapy, which is using multiple classes of blood pressure meds at once, was linked to a 38% lower risk of all-cause mortality compared to standard monotherapy. It successfully kept systolic blood pressure under 140 in over 3/4 of the patients. Because at the end of the day, a strong cardiovascular system gives your body the foundation it desperately needs to survive brutal cancer treatments. Which brings us to the final chapter, Section 5, Rebuilding the Spiderweb. Sam's actual journey to recovery was grueling, but it was meticulously managed. Right on week 1, her cardio-oncologist initiated those cardioprotective meds to stabilize her failing heart. Armed with that protection, over the next 5 months, her heart successfully withstood an intense assault of 20 chemotherapy treatments. By month 6, she went through a double mastectomy and reconstruction. And then in months 7 and 8, 33 radiation treatments. Because her medical team was interwoven and proactive, they never had to pull their punches. In the end, Sam's web kept her completely safe. Today, she's a mother who gets to wake up and watch the sunrise on her farm. She's in remission. And remarkably, thanks to our cardio-oncology team, her heart is actually stronger today than it was before her cancer diagnosis. Talk about a happy ending. So this whole story leaves us with one really provocative question to think about. When you're fighting for your life, who is in your safety net? Sam's incredible journey proves that modern medicine isn't just about finding one magic drug or one genius doctor. It's about building a highly coordinated, multidisciplinary web of care. So always, always advocate for comprehensive care in your own health journey. Thank you so much for hanging out with me today. I really hope this helps untangle the incredible science of cardio-oncology for you. Keep learning, stay curious, and I will catch you in the next explainer.